Okay, let's unpack this. Ever felt like discussions about, well, complex issues in healthcare often miss the nuance? You know, the individual perspectives. We're diving into a really fascinating research approach today that tries to tackle exactly that.
Yeah, it's pretty interesting. We're looking at a 2021 scoping review by Churruca and colleagues on something called Q methodology. Basically, it's a method designed specifically to map human subjectivity, what people truly think and feel, which is especially crucial in complex areas like healthcare.
Right.
So our mission today really is to discover how this Q methodology helps us hear many voices, how we can move beyond just simple averages to understand diverse viewpoints. And hopefully that makes you better informed about tackling some of these tricky problems.
Okay, so this method, it blends qualitative richness with quantitative rigor, you said.
Mhm.
How exactly does it work, for anyone maybe not familiar, or just as a quick refresher?
Sure. So at its heart, it involves something called Q sorting.
Hmm.
Imagine you're given a Q set that's just a collection of statements about a topic. Let's say priorities for patient care. Okay.
Right.
You then rank these statements, usually on some kind of scale like most agree to most disagree. But the key is you have to arrange them relative to each other. It forces choices.
Forces choices, I
Yeah. And the real insight comes not just from counting how many people agree with statement X or Y. Instead, Q methodology uses inverted factor analysis.
Inverted factor analysis.
Right. Think of it like this. It looks at the entire pattern of how you ranked all the statements together, your whole viewpoint.
Ah, like a fingerprint of your opinion.
Exactly. That's a great way to put it. An opinion fingerprint. Then it statistically groups people who have similar overall fingerprints or patterns. These shared patterns reveal distinct perspectives or factors. So it's about uncovering different ways of understanding an issue, not just tallying single answers.
That analogy really helps. So thinking about healthcare, it's famously complex, right? A wicked problem is the term often used. So many stakeholders, patients, doctors, policymakers. Why is Q methodology such a good fit for that challenge?
Well, the review really emphasizes its strength for exploring complex issues and taking a holistic approach. That's why it fits healthcare so well. It's particularly good at identifying opposing opinions, which is vital.
Right, you don't want to miss those.
Exactly. Otherwise, you risk ending up with these sort of bland generalizations that come from just averaging everything out that can hide what really matters to specific groups.
Can you give an example, maybe?
Sure. Like imagine a standard survey about what patients need after leaving the hospital. It might just show most people want more support at home. Okay, fine. So maybe funding gets increased generally. But Q methodology might dig deeper and find two, maybe three distinct groups. Perhaps one group, say older patients, really prioritizes daily visits from a nurse,
Okay.
while another group, maybe younger folks with chronic conditions, are more interested in remote monitoring tech. See?
Yeah, much more specific.
Right. Without Q methodology, policy might just go for the average and miss providing those really targeted, impactful solutions. Plus, it's person-centered, it's rigorous, combining that qualitative depth with stats, and it's even practical for, say, minority groups or people who might have communication difficulties. The sorting itself can be nonverbal.
That definitely sounds like a powerful way to give voice to perspectives that might otherwise get lost. Is it actually catching on in healthcare research, or is it still pretty niche?
It's definitely gaining ground. The review looked at 289 studies, and it shows a clear increase in use, especially in the last 5 years or so before 2021. Although it's fair to say it's still considered relatively novel compared to, say, standard surveys or interviews.
And where is it being used?
Oh, across a really wide range of topics, things like health professional education, nursing practice, mental health care, involving both the people receiving care and the providers. And the findings aren't just academic, they're actively informing working practices, how we educate clinicians, even policy decisions. It provides really specific insights into different attitudes, beliefs, priorities. It's proving its worth.
This whole deep dive really does highlight the importance of, well, truly understanding individual perspectives in healthcare, moving beyond those one-size-fits-all solutions.
Absolutely. It allows for much more tailored, effective approaches. And, it brings up a broader point. Considering how Q methodology helps uncover these nuances in complex systems, it makes you think, where might you, in your own life or community, apply this idea, the seeking out and mapping of diverse viewpoints to better understand a wicked problem? Maybe it's differing views on local planning or school issues, or even just understanding team dynamics where you work. Something to consider.